What does it take to become a doctor? These are the real-life stories of McMaster University's med students. On this episode of Med Students, Rupinder joins the anesthesia team. Jen assists with vascular surgery. And Amanda shares patients' fears in family medicine.
Must have been a little frightening.
Yeah, it's disturbing. Yeah. Do it perfect, just like that. Open up your mouth. Just right there.
Convocation preparations are underway for the class of 2002, but there's still plenty of work for third-year medical student Amanda Maroney.
A little more turn.
She has one more rotation to complete, family medicine.
More brain fat.
It's her last chance to immerse herself in her chosen specialty before she becomes Dr. Maroney.
I always feel like I'm kind of in my niche when I'm in family medicine because it's what I want to do, and it's confirmed that this is what I want to do for the rest of my life. So it's been a good rotation to kind of confirm things, although I kind of knew already. But it's so awesome. Every day is different, too.
A family physician needs to relate to patients of all ages. Amanda begins with 9-year-old Nicole.
So what brings you here today?
I have sore ears. I can't hear very well, and my stomach seems to hurt very often.
Oh, no. Has it interfered with your hearing?
Yes.
Yes. Okay. You can't hear as well?
No.
And what kind of a pain is it? Is it like a sharp pain, or does it feel like just achy and blah?
It feels like achy.
Achy, eh?
It's early morning,
See you later.
and family medicine resident Dr. Rupinder Saucy has another busy day ahead. He's off to Joseph Brant Hospital in Burlington for a shift in anesthesia. Rupinder hopes to specialize in emergency medicine. In this rotation, he'll get lots of practice putting breathing tubes in surgical patients.
When you're in an emergency situation, you have to secure an airway. You really don't want to sit there and have to think through the process. It really should be automatic. So this gives me an opportunity to work on getting those procedural skills down. And that's really important because it's, again, practical experience that you just will not get out of a textbook. You can see my anesthesiology textbook sticking out the top there.
Rupinder's first patient, Bobby Joe, is having a diagnostic laparoscopy for pain.
Okay. Have you ever had an anesthetic before? Is that a yes?
Yeah.
Okay. No problems with the anesthetic?
No.
And no family history of any problems with anesthesia?
No.
No? Have you had any dental work done?
Lately, no.
No? Can I get you to open your mouth for me, nice and wide? Stick your tongue out for me. Okay. Can you move your neck all right?
Yeah.
Up and down. Let me just take a look here. Okay. So we'll just get the nurses to come and see you, and we'll get things started, okay?
Okay.
Okay.
Does it hurt when I'm pulling up here at all?
No, but when you put that inside, it does.
It kind of hurts a bit. How about when I press here? Does that hurt?
Yes.
It hurts a bit, huh? We'll see what Dr. McCallum has to say, because you got me stumped, too. Okay?
Thank you.
Nice to meet you, and we'll see you in a few minutes, okay? All right.
Amanda brings in her supervisor, Dr. Kim McCallum.
Throat really sore or not too bad? Should probably swab that actually.
Now this looks like a big Q-tip. All right, nice big Oh, very good. You're really good. You are a star. I think every patient's, challenging. But with kids, I think the thing is you gotta make it a little bit fun for them. It's 36.7, which means normal. High five for that.
Yeah, I think it's just a flu bug. I don't think antibiotics are going to help this one, eh? No. You take care, hon. Thanks for your help.
If anything comes back on our results, we'll make sure we call your home. Okay, sweetie? You're welcome. My goodness, you're tall. Do you play volleyball or basketball?
Basketball.
Oh, good stuff. See you later.
Rupinder's work in the OR is supervised by Dr. Carrie Eidlitz. He quizzes Rupinder on what anesthetic would be best for Bobby Joe.
This is a very short procedure, so how much do you want to use?
Well, I'm not very good at my drug dosing on muscle relaxants, so.
I'd say for this procedure, you're probably going to use 3 to 4 milligrams.
Okay.
You're reading that book?
Not the whole thing. I'm skimming through it, but Terrence,
Well,
Terrence Chin loaned it to me.
If you read that book, you'll know a lot of anesthesia. I wonder if she's going to go off to sleep now.
Okay, I'm going to start giving you the medication to help you go to sleep. Okay, this might sting a little bit when it goes in your arm. And you've got a couple of choices. You can try to keep your eyes open as long as you can, or you can do the stereotypical counting backwards from 100.
Now comes intubation. This is the skill that Rupinder hopes will someday be automatic.
Start moving. Too far. Okay, can I get a little bit of cricoid pressure, please? That's good. Yeah, thank you. Cords are abducted. I'm going to revent or just with it with the starlight.
Rupinder is not happy with the tube's position. He reventilates Bobby Joe and starts
I mean,
again.
the visualization's a little off, but I'm also finding that just getting it up above the arytenoids is a bit tricky. Okay. Good.
Every airway is different, and some are difficult to manage. This time, Rupinder is successful.
There we go. I'm not here to be a cowboy. I'm not here to prove that I can get that tube. It's a matter of assessing the situation, knowing what's going on, and realizing that you've got a patient that's on the table. And you have to make sure that the whole reason you're doing it is to make sure they're ventilated. So it's their ventilation you've got to be paying attention to, not the ego satisfaction of getting that tube on the first try.
Hello. My name is Amanda. I'm a senior medical student working with Dr.
Amanda's next patient, Mr. Baumgarten, has memory loss and is waiting for the results of an MRI.
What kind of symptoms were you experiencing that prompted you to have an MRI?
I had a few memory failures.
Okay. And when you say memory failures, what couldn't you remember? What kind of things were?
The time and circumstances suddenly dissolved. I didn't really know where I was and who I was.
Must have been a little frightening.
Yes, it's disturbing, yeah.
Flashlights in the fridge, food under the sink. It's very interesting.
Oh, goodness. Okay. How long do you have these memory lapses for?
But an hour?
Well, they go from day to day. Sometimes they'll last, and sometimes they won't. Sometimes they last all day.
I don't know enough about interpreting MRIs yet to give you adequate information. Although I do have the report here, sometimes the lingo used I'm not familiar with, so we'll interpret that with Dr. McCallum.
First-year med student Jen Robinson has always hoped to become a surgeon.
Ooh, the lifestyle of a surgeon. I don't know. I think it's the right thing.
This morning, Jen has her favorite elective, vascular surgery. She'll grab a ride with her favorite classmate, Wyatt.
Wyatt is my boyfriend. He's a second-year medical student at Mac and has been amazing sort of mentor and helping me sort of along the course of things. He's already been there. He's a year ahead of me and very supportive, very loving. So he's been fantastic. doing some vein stripping today. So the patient has varicose veins. We're going to take them out. And this is a new experience for me. I've never been in the OR for a vein stripping before, so I don't know much about it. If I get asked some questions, I'm going to fail. But it should be a good learning experience for me.
Mr. Baumgartner had his MRI about 10 days ago. Okay. And these are the results. I didn't feel comfortable.
Amanda and Dr. McCallum review the MRI results with Mr. Baumgarten.
Okay. What it just shows is that it's called diffuse cortical atrophy. It just means the brain has shrunk a little bit. Now that happens a bit with aging sometimes. There's nothing we really do about this. There's no specific like tumors or anything bad going on. It's just sort of a generalized process, so it's not showing anything too serious. There's nothing like a tumor or anything to worry about.
How long is that expected to go on?
Well, when that sort of process, I mean, with aging that happens. The brain shrinks somewhat with age. The other thing that causes that sometimes is if there's any infection going on. You haven't had a cold or cough or...
Oh yes, got a very bad cough.
Yeah, that might be doing something too.
Perfect. Excellent. It's hard for me because I have parents who are getting, you know, they're certainly not old, but you know, someday they're going to be this population, you know, and I had grandparents who were very ill, and it brings back a lot of memories for me in dealing with grandparents my grandparents when they were sick. But a lot of the times, you know, that helps me relate to the patient in a different way.
Probably just you've got a bit of a cold and it sort of tipped the balance. I'd keep an eye on it. I don't think we need to do anything right now. If it happens again, let me know though. Okay. Take care then.
Thank you very much. Nice to meet you.
Rupinder adjusts Bobby Joe's medication throughout her operation.
The anesthetist is taking care of everything the surgeons are, so the surgeons can concentrate on the actual procedure they're doing. You're keeping track of the patient's level of consciousness, you're taking care of their pain control, you're looking at their physiologic markers, their heart rate, their blood pressure, and so on. You're running in fluids to compensate for fluid losses and keeping an eye on the patient and making sure nothing bad goes wrong. This is propofol. Sometimes we nickname it milk of amnesia. It's the anesthetic reason to keep her asleep.
It's a quick procedure, and Rupinder needs to prepare to wake up his patient.
He's going to be finished in, say, 10 minutes or so. So how are you going to get this patient awake?
Well, I mean, the propofol does not take very long to wear off, so 2 to 5 minute mark, you can turn the propofol right off.
Every 3 cc's you give a patient, then you'll have 2.5 and 0.5.
Okay.
Jen scrubs up with her supervisor, vascular surgeon Dr. Jacques Titley.
Let's talk a little bit about this case, Jennifer. Okay. This patient has what's called primary varicose veins. Primary meaning she probably inherited it from her mom or her dad.
Varicose veins are painful and can cause serious blood clots. Jen and Dr. Titley will cut the veins so that the blood is redirected to normal veins.
Okay, what I'm going to do here is stretch it out like that for you. I'm going to take the 11 blade. That's a number 11 blade. Each blade is a different configuration to it. So you don't want to go like this because you're going to get the vein underneath. You want to go like so, just a little bit.
So how do you know how deep?
You just kind of don't. You can go that way, that's fine. Not too, that's too steep an angle. No, that's very steep. Less steep, so more shallow plane, like so. Okay.
The stressful part for me is cutting, is sort of sticking the blade into someone and making sure you're not going too deep for someone as inexperienced as I am. So your heart's pounding a little. I was thinking, don't screw up.
One, two, three.
Rupinder moves Bobby Joe into the recovery room and waits for her to wake up.
Where my comfort level is changing now is the first couple of weeks I haven't been spending a lot of time drawing up the actual medications, calculating the dosages, and putting them in. I've just been turning to the anesthesiologist and putting them in. He's been telling me what he's been doing. So it's a bit of a shift for me, but it's a shift that I want because part of my reason for being here is to get comfortable with that kind of stuff. So that's something where you're seeing my learning curve. I'm sort of at the bottom and working my way up at this point. She's still pretty deep. No corneals yet. So.
Bobby Joe takes a telltale deep breath.
Aha. Okay. Off and running.
Jen's next task is to expose the varicose vein. Knowing how deep to cut only comes with experience.
You're almost through the skin, but there's a very superficial vein here. So here, we're just gonna cut another micro layer here. See right there? It's very subtle, isn't it? There's your vein right there. Go ahead. That's good. Okay.
Jen's got it. Now she has to pull the vein to the surface to make the cut.
That's quite nice. Now you see the vein there? What I want you to do in your mind's eye, it's actually a blind shot because this instrument prevents you from seeing. So you're going inside, you're grabbing the vein, you're pulling it out gently. Okay, go ahead. Open, grab, and pull out gently. Go a little bit bigger bite. Oh, we almost got him. Just grab, go in there and get him. Go get him. Yeah, you almost got him. Okay, let me just see what I can do here.
Dr. Titley lends a hand.
Oops, I was luckier. I got more experience of fishing than you have.
It's really important for a medical student to feel comfortable. The stress of the procedure itself is enough, but yeah, if the team isn't making you feel welcome, then it's just an added stress, and performing under that isn't always ideal. So yeah, these guys are great. Definitely felt like part of the team. Makes for a good learning environment.
Hard to do, huh? Too bad you're not an octopus. Good. More with it. That's it. Good for you.
Amanda's last patient, Theo, is in the prime of life, but needs heart surgery. He's monitored weekly to ensure he remains stable while he waits for the operation to be scheduled.
Any chest pressure or anything?
Occasional. When it does hurt for a deep breath, it actually feels tender to the touch. I go like this and I can feel it. I mean, yesterday I carried a water jug, a jug of water up to the water cooler. Like I'm a big, strong guy, right? 20 pounds. I had to stop halfway up the stairs and rest. Put it down and actually sit down on the stairs and get my breath. Had to do it in two halves.
Have they given you any dates yet for the surgery?
No. I've got a follow-up appointment with him in May, and he figures that the angiogram should be done by then. And then we move into the next step of the open heart surgery.
Sorry about my cold hands.
That's all right.
There's often the remark that, over time, all doctors start off really empathetic and they really start off, really caring about their patients, and with time they just stop caring and they just sick and tired of hearing things. I hope and pray I never, ever become like that. I think when I do, then that's when I have to take a step back and stop.
See the arrhythmia though?
A few irregular beats, but it's actually more steady than it was. Yeah, a lot more steady than it was.
Take care.
Okay, man. Thanks a lot, eh?
This is my last week, so I won't.
Come hug.
Yeah, for sure. Take care.
Good luck, eh, girl?
Thank you.
Enjoy your summer.
You too.
All right.
There's two ways to close these. If they're big and gaping...
Dr. Titley and Jen have cut their patient's varicose veins. Now it's time to close the wounds.
A simple suture. You have to make sure that you enter the skin
Perpendicular to the spine.
at the right angle so that you end up with something like that, okay? Perfect.
I'm exhilarated. It was fantastic. So I'm looking forward to doing more. Have the high-risk stuff if they'll let me in there. I don't know if I believe that being in med school has changed me per se. I think maybe I've become a bit more of who I am. definitely rising to the challenge. I mean, I think I've always been able to rise to a challenge, but here the challenges are very different.
Rupinder's finished in the OR and can spend the evening with his girlfriend Fiona.
Hello. Fiona's right over here. We've been together for 7.5 years.
She's studying to be a veterinarian. With 2 jam-packed schedules, everything in their lives has to be planned. Absolutely everything.
We take turns. During the school term, we set it up. Somebody does it weekends, somebody does it weekdays. We actually have to have a schedule to make this work. Otherwise, the cats start complaining. And when they complain, it gets a little messy. So
Yeah, they start
leave us
protesting
memos.
by using potted plants. Our first date consisted of ball gown, formal wear, an evening at a nice French restaurant, followed by a group of us going to a monster truck rally. Just for the sheer absurdity of it.
At the Sky Dome, in a ball gown, in the middle of winter.
Do you have bunnies in your ears? Can I check and
Now that Amanda's rotation in family medicine is almost over, she undergoes an official student evaluation with Dr. McCallum.
Are there bunnies in here? I don't know.
So how do you feel you did on this rotation? That's me, Nick. History taking. You have fantastic history taking skills. You have a clear, orderly documentation of these. And I said your playful manner with children enabled you to easily do complete examination on toddlers and to be well received by them. You have shown increasing comfort in your family medicine abilities over the rotation, and that you did begin, however, with excellent skills and communication skills, and will do wonderfully with any family medicine residency that you choose. It's been a pleasure.
Or that chooses me. I'll find that out soon.
So there's a good thing for you. What a way to end.
Yeah, bang.
We'll miss you. It's been fun.
Thank you.
On the next episode of Med Students, Karen assists with a lumpectomy. Andrew works the emergency room. And the graduating class get their degrees and start residency.
Dr. Amanda, I like that. Or just Amanda. I haven't really changed my person.